GastroEsophageal reflux, heartburn, or you feel food or acid coming up here, here, here. It's a common problem, and a lot of it is caused by allergies. A quarter of people who have allergic rhinitis or nose allergies have atypical gastroesophageal reflux, and 3/4, 75% of those with asthma have atypical reflux. So it's hooked in as part of the mechanism of having allergies. That's why we deal with it a lot and see a lot of it and treat it, because it's affected by the allergies. What we found too is that if you can get your allergies under control, it can eliminate reflux or get it under better control. So how is it attached to the nose? Well, with allergic rhinitis, you get a lot of mucus production, and it goes down here. You get that postnasal drip that I talked about with cough, throat clearing, sore throat, and it goes down here into the stomach. Stomach doesn't like that stuff. So it rebels, produces extra acid, and that bothers you, and then that can come up. There's also a theory that I have that stuff, when it goes down your esophagus into your stomach, there's a sphincter here. Okay, it's not a valve, it's a sphincter, like your anus. And what happens is that when the esophagus or eating tube feels food, it goes, ooh, stuff, and it opens up, and the stuff goes down. So what I think is that when you have mucus production and postnasal drip and you swallow it, it coats the lining or the wall of the esophagus, and it says, oh, stuff, and it opens up. Well, since there's no bolus or amount of food to go down, then when it's open, stuff comes up, and that adds to the reflux. So again, by cutting down or eliminating the mucus production, getting the allergic or non-allergic rhinitis under control, that helps the reflux. What's its connection with asthma? Well, actually, in the embryo, when you're forming, the breathing tube and the eating tube are actually from the same cells, and then they become two separate tubes. In fact, sometimes they're actually attached in kids when they're first born. And when they take their first drink of milk, they choke because there's still an attachment. That's how intimate they are, and they talk to each other. So when you get really, really bad reflux or heartburn, people have trouble breathing. They feel short of breath because there is that connection or mechanism or reflex. So getting your reflux under control helps asthma. There are many people who are on 1, 2, 3 medications for their asthma, and they get their reflux under control, and the breathing gets better. I've even had a couple of patients when they've gotten their reflux under perfect control, sometimes with medicine, sometimes by surgery, their asthma symptoms go away. So it's something to be looking for. Why do we want to know about reflux, and why do we want to treat it? Because, well, it hurts. You know, there's pain here. But even maybe more important is, what can reflux do to you? This is hydrochloric acid that's bathing your esophagus. So your stomach is ironclad. It was meant to see this acid. And if you've ever gotten acid on your fingers or your skin, you know, you've had this little burn. The esophagus was never really meant to see acid, so that's why there's such pain when the stuff comes up. But what can that do? And what are the dangers of untreated or undertreated reflux? Well, it can eat away. It could put holes in your esophagus. That's not cool. Also, you can get scarring. So you've seen people with burns where they have scarring on their skin. Well, if you can imagine scarring here, that would make the diameter or size of the eating tube smaller. Well, then food can't get down. You eat solid food and it won't go. And then what that means is a surgeon has to go in and dilate you every year to 2 years to keep your esophagus open so you can actually eat food. Also, all that acid irritation, what can it do? It can cause something called Barrett's esophagitis, which is a precancerous lesion, which means it causes cancer. I don't know why they call it precancerous. Just say, hey, if you don't treat your reflux, you can get cancer from it. So these 3 complications can be avoided by diagnosing and treating the reflux, and again, by getting allergies under control and asthma under control. There's also one other thing. I mean, what if this stuff comes up and goes down the wrong tube? That's aspiration. That can kill you or put you in an ICU. So knowing that it's there, knowing that you can treat it, that's something you should never let go. So again, something else that we deal with as allergists.